As the coronavirus spreads across the country, some long-term problems become more apparent, including racial disparities in health. That's one conclusion from the figures on rates of infection in Boston's neighborhoods, as well as other parts of the state. One response to that is the recent increase in testing at Boston's community health centers. Our guest is from one of them, the president and CEO at the Harvard Street Neighborhood Health Center in Dorchester, Stan McLaren. Thank you very much for being with us again, Stan.
Thank you for having me.
Yeah, before we get into the testing, what about the feel of what you see in the neighborhood around the health center? What are you most concerned about right now?
I'm really concerned that we have a lot of young folks that are not taking this very seriously. I see kids that are not wearing masks. They're congregating, they're hanging out. And I understand that social distancing and being isolated for long periods of time, people want to gather, it's our nature. But with this disease, and especially how it's impacting the Black community, Black and brown communities, I think it's extremely important that we exercise caution, because yes, it may not impact you as much, but then you're going back home and you're giving, you're living in tight quarters with your grandmother, father, your abuelita, your nana. I mean, this is very serious. And that's the biggest piece for me. And then we have, we got bodegas in the community, and they have tight quarters. And, we really need to be mindful of social distancing. And this just becomes more exacerbated because we're disproportionately affected. People of color are disproportionately affected. If you look just throughout the country, in major states, even when you have Black and brown people that don't make up a significant portion of the population, they're overrepresented in those that are dying from this disease. So I just want to really, however we can get the message out that, we need to take this thing serious. All of us need to act like we have this disease.
It's hard for me to figure out because I go to a supermarket very often near Jackson Square. I see people of color all the time now with masks on. They seem to be very earnest about it. But there's something that takes to mind when people are outside there with friends in a very informal setting. What's the difference?
Well, I just think that, this is not normal to stay away from folks. And I just think that, especially people want to be able to congregate, get together. I mean, you're not even able to go to church services like you used to. And in the Black community, church plays a very important role. And so it's we got to create a new norm. And this new norm is very difficult to adapt to, and people feel okay, so they feel that it's safe, and it's just not. You never know what's gonna happen, how people, potentially the way this disease stays in the air, if you could potentially be affected. So I just think people need to be vigilant at all times and realize that we're in a new way of being.
Is there a problem with getting some kind of even a rudimentary mask or face covering?
It's funny. I was just having a conversation with staff. We're trying to do some campaigns, and we were looking at. It's masks, things like that, like N95s, things like that are scarce, right? And I was having a conversation with our staff. I'm saying, yes, we can go and probably give out some of the masks that we have, even though we really need those. But you can make a mask with scarves, you can make a mask. I mean, if you go on the internet now, everyone's showing you how to make these masks. So, mask is, that's not the issue right now. People need to get face coverings and need to be vigilant about keeping it on. Some people are wearing the mask underneath their chin. I mean, that defeats the purpose of having the mask. And I just think, it's inconvenient, but you got to think, if you're not thinking about yourself, at least think about others, because that's what happens if you don't have a mask. It's more, to be honest with you, the mask is more to protect others than it is to protect yourself. But if everyone's wearing a mask, then everyone's protected. So we just really got to be serious about this. And literally, like I say, my office is across the street from Franklin Park, and I look out the window and I see kids hanging out and they're congregating, they're playing music and everything else. And I understand, but it's just, you got to act like everyone has it, and you got to be concerned about the people around you, and you got to be concerned about your family members and your grandparents and those folks that you may go back home and you have an uncle that has diabetes or heart disease, and these conditions really have a serious consequence if these folks become sick by the disease, because this is a social determinant disease, and it really has a significant impact on people that have underlying conditions, and it tends to have a more fatal result.
I want to ask you about the testing. You've done a lot more of that since the last time you joined us, and I think you recently said 40% of the people tested positive. That sounds like a pretty high percentage, doesn't it?
Well, it does, but we do screen. I mean, those are people that have called us and had symptoms, and the number has gone up. It looks like it's more like around 45 to 48% of those that have called and that our providers have had a conversation with, screened, and tested, ended up testing positive for the disease. So yeah, we have seen an uptick in. There's been an uptick in those that have been testing positive.
What happens next when people get the results?
Saying what happens when you get, after you get the result, there's no treatment for this, right? So we're telling you to isolate yourself when you get these results. We're telling folks to isolate themselves and to monitor them to see if we need to take the next steps, if they need to really go to the emergency room. But I think the issue that we have is we have a lot of our population are in close quarters, living with quite a bit of people in their homes and apartment buildings. So you have less square footage in which to move around with. So, we're trying to just give advice on making sure that people realize they really have to isolate. They really need to disinfect the spaces. They need to have one of the bedrooms stay to themselves, so that they don't infect others in the house. And then everyone needs to be vigilant about making sure that they're wiping things down and that they're mindful of where the person is that may be infected. But there's no treatment for this. So we're just monitoring individuals, and then, hopefully we don't have to have you go to the emergency room. But the idea here is to control the spread so that we don't have a bunch of people heading up into the emergency rooms.
The projections we hear are that this virus is not going to suddenly disappear entirely, even during the summer. Are you worried what it's going to be like when people are going to be really hot? A lot of them won't have air conditioning.
Yeah, that's going to be a problem. I'm hopeful that, we don't know enough about this disease, and that's part of the problem. And that's why I keep preaching that we all need to act like we have it. So we act accordingly. But yeah, we're concerned about the summer months that are coming up. I think what's going on right now, that I, as a health center leader, what I appreciate is the fact that we have real leadership here in Massachusetts. There's collaboration between the mayor and the governor to try to make sure we have the resources we need to go forward. You have health centers in the community that are being stood up through the Boston Resiliency Fund that the mayor has, so our testing capacity has increased dramatically over the last couple of weeks. So we're gearing up for this. We're making sure that we're stocking up with test kits. We're partnered up with Quest to make sure that we have testing that's available. So I think if we can keep the messaging out there, we build the capacity for testing. We're putting testing in areas. When I say build capacity for testing in areas where there are vulnerable people, where the people can have good access, especially in my community. Community health centers have been here for a long time. We've been partners with the community for decades. So we're a trusted entity that people feel comfortable reaching out to. So we are gearing up for the coming months.
Part of your normal workday is that you see a lot of people heading to their jobs on Blue Hill Avenue. Any advice for reopening and how to do it safely?
I think it needs to be done cautiously. I think the testing capacity needs to be increased, which was something that we're working on right now. I think that we all need to continue to practice as if we all need to act as if we have the disease, but at the same time, it just needs to be done slowly. We need to see, in my opinion, a downward slope a bit with regards to the testing. I think when you talk to when you get various guidance, like from the CDC and everything, I think one of the things they're always putting down is they want to see a particular decline. I think it's 14 days of a decline before we start to really open things up. I think we have to think through a new normal, like my health center, for example. As we open up and start to see patients here more, we can't go back to the same thing. Chairs are going to be 6 feet apart. I'm going to have plexiglass for when you walking in the door for my customer service representatives. Everyone is going to be wearing masks. So I just think as we open back up, we need to think that this is not going to be business as usual. There are going to be some significant changes. I would like to highlight, though, that not only will there be significant changes in the workplace, but I think I'm hopeful that this disease, what it's doing in the communities of color, would be a wake-up call that we need to do things differently, that we need to think of ways to get folks out of, make folks be able to be upwardly mobile, so they're out of the type of jobs that are just low-wage jobs that are keeping them in just essential roles. In other words, thinking of keeping a whole set of community just in those kind of roles where there's no upward mobility. And I think we need to think about those roles, think about making sure that everyone has proper PPEs. So it's going to be a new norm, and there's going to have to be a whole bunch of adjustments because this disease is very serious, and we need to treat it that way.
Finally, Sam, just a little time here. If people want some help or information from the health center, what's the best way to get that?
They can give us a call, 617-825-3400. We do testing 6 days a week. We're open from 8:30 to 4:30, Monday through Friday, 9 to 3 o'clock. If you want to reach out to health centers, please check out the city's website, and they'll list all the health centers that are potentially in your area. If you feel that you have a concern, a fever or anything like, if you have some of those symptoms, please make sure that you get in touch with your primary care provider. If you don't have one, feel free to call us. We're here, we're available. But yeah, people really need to be careful and be safe. And I love this community, and I love this community. And at the end of the day, I heard a reverend say this: this is a we disease, and the only way we get through this is together. And we all have to be vigilant together and trying to overcome this situation.